introduce ourselves from Group 8, Class A. My name is Naysila Putri Nggolitu. I act as a nurse who is in charge of providing airway management intervention.
Hi guys, I would like to introduce myself. My name is Rayda Khairiyah Putri Sidiki. I play the role of a nurse who performs an effective coughing exercise intervention.
Hi guys, I would like to introduce myself. My name is Afrilia Baid. I play the role of a nurse who carries out asthma management intervention.
Assalamualaikum warahmatullahi wabarakatuh. I would like to introduce myself. My name is Ruslin Tumu. I play the role of a doctor.
Hi guys, I would like to introduce myself. My name is Rahmola. I work as a nurse providing health education.
Hi guys, let me introduce myself. My name is Sahfiqra Basiru. I play the role of a patient suffering bronchial asthma.
Guys, sit back and enjoy.
Miss R, a 19 years old female university student, was brought to the emergency department with complaints of shortness of breath, chest tightness, and wheezing that started early in the morning. She reported that the symptom worsened after cleaning her boarding room, which was dusty. She also experienced persistent coughing, especially at night. Miss R has a history of bronchial asthma since childhood. She used a short-acting bronchodilator inhaler as needed, but admitted that she sometimes forgets to carry it with her. She has no other chronic illnesses. Her mother also has a history of asthma. Upon assessment, the patient appeared anxious and was sitting in a tripod position to ease her breathing. Vital signs were blood pressure 120 per 8 mmHg, pulse rate 110 beats per minute, respiratory rate 30 breaths per minute, temperature 36.7 degrees Celsius, and oxygen saturation 89% on room air. Audible wheezing was heard during expiration, and the use of accessory mask was observed. Peak expiratory flow rate (PAFR) was significantly below her personal best.
Bronchial asthma is a long-term inflammatory condition of the airways that causes hyperactivity. It is characterized by chronic inflammation of the bronchi with varying levels of severity. This condition is also accompanied by recurrent symptoms such as coughing, wheezing, difficulty breathing, and a feeling of tightness in the chest, especially at night or in the early morning, due to obstruction of the airways. Factors known to be associated with asthma include genetic predisposition, particularly a personal or family history of atopy, an allergic tendency that might appear as eczema or asthma. That overall etiology is complex and still not fully understood, but it is generally agreed that the etiology of asthma is multifactorial, influenced by genetic factors and environmental exposure. The first intervention is airway management. Airway management is identifying and managing airway patients.
Nurse, I feel very short of breath, nurse.
nurse who is on duty today. What is your name?
My name is Putri, nurse.
Alright, wait a minute. Did you do anything before the symptom outbreak?
I have been feeling short of breath since this morning. My chest feel tight and keep holding, nurse.
Do you have a history of asthma?
Yes, nurse. I was cleaning my boarding room and it was very dusty, nurse. And I have had asthma since childhood.
Did you bring your inhaler with you?
No, nurse. I forgot to bring it.
Alright, Putri, we will help you so that you can breathe more comfortably. Mrs. Putri, I will check your breathing condition first.
Yes, nurse.
Put your hand on your shoulder. Your respiratory rate is about 30 breaths per minute and you are using accessory mask to breathe. Alright, Mrs. Putri, to help your breathing, I will adjust your position into a semi-forward position like this.
Alright, nurse. this position is a little more comfortable.
Good, Putri. This position helps your lungs expand better, so breathing becomes easy.
Alright, thank you.
Now I will monitor your oxygen saturation using this device. So your oxygen saturation is about 89%, so we will provide supplemental oxygen to help increase the oxygen level in your body.
Alright, nurse.
That is alright, Putri. Later, Nurse I will help you with calming exercise to make your airway more comfortable.
Alright,
Effective coughing exercise is training patients who are unable to cough effectively to clear the larynx, trachea, and bronchioles of secretions or foreign substance in the airway. Coughing is the best and are the next invisible tonight. Taking care of your day. How are you feeling now? Good morning, nurse. I still feel short of breath and I keep coughing, but the mucus feels tight in my chest. I understand. I will first assess your ability to cough. So, how will try coughing for me? Coughs will be activated, but doesn't feel very intense. I see. I will also check whether there is total retention in your airway. Have you noticed any mucus when coughing? Yes, sometimes there is a little thing mucus. Alright, I will also monitor signs of respiratory infection such as fever. Infections could in change in special colon. Have you had fever recently? No, I haven't had a fever. Oh good. I will also monitor your food intake and output because adequate fluids help clean the mucus. Okay, now I will help you perform an effective quality exercise to clear the mucus from your airway. Next, I will place a protective pad on your ear. Please lean slightly forward. Next, if any mucus comes out, please put it
into this button container. Miss Putri, before you coughing, you inhale slowly your nose and exhale slowly your mouth. Inhale, exhale, inhale, exhale, inhale. Okay. If any mucus come out, please fit it into this sputum container.
Okay, nurse, I understand.
Okay, so. Good miss, that is the goal of this exercise. By clearing the mucus, your airway becomes more open, your breathing improves, and the risk of infection is reduced. Please make sure to drink enough water, as it helps cleaning the mucus and makes it easier to expel. Avoid exposure to dust, smoke, or cold air, as this can worsen mucus production and breathing difficulties. You can repeat this exercise several times a day if you feel mucus buildup. Thank you for teaching me, nurse. You're welcome, miss. If you feel more shortness of the breath, chest pain, fever, or if the mucus changes color, please inform the medical staff immediately.
Identifying and managing airflow obstruction due to allergic reactions or airway hypersensitivity causing bronchospasm refers to the process of recognizing and treating conditions in which the airways become narrowing.
This narrowing is typically caused by inflammation, excessive mucus production, and tightening or of the airway muscles, bronchospasm, triggered by allergens or irritants. Effective management aims to relieve symptoms, restore normal airflow, and prevent further.
Good morning, Putri. I'm the nurse taking care of you today. I will assess your breathing condition.
Good morning, nurse. I still feel short of breath, nurse.
I understand. I will observe for signs of hypoxia such as restlessness, agitation, or decreased consciousness. Are you feeling this?
I feel a little anxious and tired, but I am still full aware.
Yes, this is Antu for instance.
Alright, I will also monitor your oxygen saturation to see how well oxygen is circulating in your body. Alright, Nayat, I will check your oxygen saturation.
if there is excessive mucus blocking your airway, we might perform suction to help clear it.
Okay, nurse, I understand.
We will also collect a blood sample for a complete blood count and arterial blood gas analysis to evaluate your oxygen and carbon dioxide levels.
Excuse me, Miss Putri. Good morning. I am Dr. Evan. I have reviewed your condition and it appears you're experiencing an asthma exhibition.
Doctor, it has been difficult for me to breathe.
Don't worry. We will help manage your symptoms and improve your breathing.
This would lead anxiety can increase your body's oxygen demand. Try to calm and relax.
I feel nervous because it's hard to breathe.
That's understandable. Let me greet you through slow and deep breathing. Please inhale slowly through your nose and exhale slowly through your mouth. Like this. Let's try.
Okay, like this, nurse.
Yes, very good. I will also touch you deep first lips breathing technique. Inhale slowly through your nose. Then exhale through your lips as if you are breathing out a candle.
I think that helped me breathe a little easier.
That breathing technique is very helpful for patients with asthma because it keeps the airways open longer.
You should also try to identify and avoid asthma triggers such as this. Smoke out cold air.
I think last time write my symptoms this morning when I cleaned my wound.
Yes, dust is a common trigger. It is important to keep your apartment clean and avoid dust exposure. Nurse, please administer a bronchodilator such as albuterol via inhalation.
Yes, doctor, I will administer the bronchodilator as prescribed. Permission.
Yes.
With your permission, Mia, I will administer the bronchodilator as directed by the doctor.
Okay, thank you, nurse.
If the symptoms do not improve after the bronchodilator, we may control the traditional medication such as prednisolone, methylprednisolone, and amipiline.
We will continue monitoring your oxygen saturation and overall condition.
Thank you, doctor and nurse. I feel more reassured now.
You're welcome. We will do your best to help you recover.
Education is teaching the management of disease risk factors and clean and healthy living behaviors. Miss Putri, now that your breathing is a little better, I would like to provide some health education to help you manage your asthma. Is this a good time for you?
Yes, nurse. I would like to learn how to prevent this from happening again.
Before we start, I would like to identify your readings and ability to receive information. Are you feeling comfortable enough to listen and discuss now?
Yes, I feel better now and I am ready to listen.
Good. I also want to understand what motivation you to maintain a clean and healthy lifestyle. Are there any challenges to make it difficult for you to keep your environment clean or avoid asthma triggers?
Sometimes I am busy with my university assessment, so I clean my room quickly and forget to wear a mask when it does.
Thank you for sharing that. I will provide some educational materials to help you understand asthma management better. This brochure explains asthma triggers, healthy lifestyle habits, and ways to prevent asthma attacks.
Thank you, nurse.
We can also schedule another health education session later if you would like to learn more about asthma self-management.
Yes, that would be helpful.
If you have any question during this discussion, please feel free to ask. Miss Putri, asthma can be triggered by several risk factors such as dust, cigarette smoke, air pollution, cold air, and respiratory infection.
I didn't realize that's cold trigger my asthma so easily.
Yes, that is one of the most common asthma, especially for people with allergic asthma. To maintain clean and healthy living behaviors, you should keep your room clean, avoid dust accumulation, and ensure good ventilation.
I will try to clean my room more carefully.
You can also ask rabies to improve healthy living behavior, such as wearing a mask, cleaning, washing bedding regularly, avoiding cigarette smokes, and always carrying your inhaler.
That makes sense. I often forget to bring my inhaler.
It would be helpful to keep your inhaler in your bag so you always have it with you.
Thank you for the advance, nurse.
You're welcome. Clean and healthy living behaviors can help reduce asthma attacks and improve your overall health.
Excuse me, nurse. Nurse, how is patient condition?
Doctor, the patient condition has improved significantly. Her breathing is more stable. Oxygen saturation is within normal range, and she can perform effective coughing and breathing technique.
That's good to hear. Has he understood the health education provided?
Yes, doctor. She is able to identify asthma triggers and demonstrates proper breathing technique.
Excuse me, Miss Putri. I have reviewed your condition and I'm happy to inform you that your asthma attack has resolved.
Thank you, doctor. I feel much better now.
Before you go to home, I would like to make sure you understand how to manage your condition. What are the triggers you should avoid?
I should avoid that smoke and cold air. I will also wear a mask when cleaning my room.
Very good. And what will you do if you start feeling short of breath again?
I will use my inhaler immediately and try the breathing techniques. If doesn't, if cough, I will go to hospital.
That's correct. Also, don't forget to always carry your inhaler with you and maintain a clean and healthy lifestyle, such as keeping your room clean and avoiding asthma triggers.
Yes, I understand. I will take the better for my health.
Good. You are now stable now and allowed to go home. Please follow the instruction and come back for follow-up if needed.
Thank you, doctor and nurse, for taking care of me.
You're welcome. Take care and stay healthy.
Thank you.
Okay, excuse me, miss.
Group A, caring with heart, healing with skill.